Hello, I'm Dr. William Lawrence with Ortho Sports Athens, located in Athens, Alabama. I would like to talk to you today about carpal tunnel syndrome. Carpal tunnel syndrome is one of several common hand problems. Carpal tunnel syndrome typically presents as someone that has difficulty sleeping at night. You'll notice that you wake at night, possibly shaking your hands out to get the feelings back. Carpal tunnel syndrome is usually a slow onset. You may start that the numbness and tingling is not so bad or so severe, but over the course of weeks or months it can come on a little more substantial. Carpal tunnel syndrome that has been ignored or long-standing can actually lead to where someone can have permanent numbness and tingling or weakness in the hand. Typically it involves the first three fingers of the hand. The carpal tunnel nerve is called the median nerve. It actually supplies sensation to one half of the ring finger as well as the thumb, index, and long finger. First step of treatment is typically we will place patients into night splints. The reason we place you into night splints is as we sleep we tend to draw our hands in. That puts increased pressure in the carpal tunnel and seems to make the symptoms much worse. If night splints do not work, you can also try steroid injections. The steroid injection is placed into the carpal tunnel, typically in this area of the hand. Carpal tunnel injections over the course of a year tend to be transient relief at best, but some people it can alleviate enough of the symptoms for them. If carpal tunnel syndrome becomes severe enough, then we have to talk to you about a carpal tunnel release. The way this is diagnosed preoperatively is we send you for a test called a nerve conduction velocity, or an EMG. On that test they will tell us if you have carpal tunnel syndrome, and they can grade the severity as mild, moderate, or severe. If someone has moderate or worse carpal tunnel syndrome, the recommendation is release. The reason is that carpal tunnel syndrome involves scarring of the median nerve. Once you have scarring of the nerve, we cannot guarantee that you will regain the lost function or sensation. The advantage of the carpal tunnel release is that we can go in, release the nerve, and over time the nerve can heal itself. Carpal tunnel release is done in a couple of different fashions. One is an open release, which is an incision between my finger pads of roughly an inch long, located in this area of your palm, that is closed with simple sutures. Normal recovery period is 2 weeks for skin healing. Then the sutures are removed. Everyone notices a firm sensation around the incision that is called induration, which is normal healing, and it will resolve over 6 to 8 weeks. As far as function and use of the hand, you can use your hand for clerical duties almost instantly post-operatively. If you're a laborer requiring use of your hands to pick up heavy objects or to manually manipulate hammers, machines, etc., the recovery is typically 2 to 4 weeks before you can return to that. A second option for surgery is an endoscopic release, which is typically a small incision before the wrist and a small incision in the hand. Those again are closed with simple stitches. You still end up with a firm sensation in the palm due to the healing. If you have symptoms or other common problems or problems with the hand, then please come see us at Ortho Sports Athens.